Prevention is better than cure. That has served as the cardinal guideline in the last 50 years for the Sakku Central Hospital to guide its steps in moving forward together with the local farming population. It is precisely in line with this dictum that the hospital regularly sends out a caravan mass health screening team to rural communities under a multiphasic outreach healthcare program in response to a call from their residents, however far off they may be in this alpine prefecture. The healthcare program implemented under the motto of prevention is better than cure comes in two phases: a basic health checkup and, if need be, a workup. Both screenings are made up of an elaborate checklist of items. Let's look at the basic health checkup first. This checkup is performed at the local assembly hall. Each examinee comes to the hall carrying his or her health pocketbook. The checkup consists of EKG, blood and urine tests, medical examination, measurement of blood pressure, examination of skin cancer resulting from long exposure to ultraviolet rays. In recent years, the screening team has come to focus more on the early detection of cancer and the prevention of seikatsu shukanbyo, or lifestyle-induced ailments, or seijinbyo, or diseases progressively degenerative with age. Already in the early morning, the X-ray camera-loaded van is on the way to the community where a mass health checkup will be performed, known as the Caravan Mass Health Screening. It is a common practice for this hospital to carry it out with the cooperation of the local administrative authorities and agricultural cooperatives.
お腹を膨らませて楽にしてそこでね息を止めてましょう。しっかり息を止めてます。
粉になっておりますからね。口の奥へ入れて、これが一番先です。これ2番目水です。はいどうぞ。息をね止めてましょうか。しっかり息を止めてましょう。ぐるーっと回って仰向け。はい向こう向いて真横。右下で真横です。もっと横になっちゃってもっと横に。はいいいですよ。はいいいですよ。そこでね息を吸ってずーっと吐いてはい止めてましょう。しっかり息を止めてます。はい
With the screening scheduled to start at 6:30 in the morning, the medical staff has to leave the hospital shortly before 6. Persons in whom suspected symptoms have been detected and those with anamnesis are told to undergo an endoscopic stomach workup. In many instances, the screening starts in the early morning in response to a call from some local residents who, after the screening, want to have breakfast and then go to work. More than anything else, the Saku Central Hospital has attached importance to the needs of community residents in the last 50 years.
じゃあ小出さんね、今日もまたね食堂から胃袋、いろいろ12食ここまでね、中よく見ておきます。
Coined by Dr. Toshikazu Wakatsuki, founder of the hospital, the rallying words, "Together with farmers," crystallize its philosophies and approaches.
だからこれまたね、これかなり引き連れてるから、もしこれバリウム飲んでね、引っかかっちゃう可能性あるから、また来年もカメラでやりましょう。
Kept in the archives of the hospital is an old film which depicts the way in which its staff delivered medical care in an out-of-the-way hamlet to which they'd been sent out during their off-duty hours in the 1950s. In those years, almost every village deep in the mountains of Nagano Prefecture was without medical services. Looking back through the vistas of the past, Dr. Wakatsuki has this to say. Virtually every visitor to our hospital's clinics suffered from diseases too late to cure. Naturally, it was important for us to do the best we could for them. But the more important thing was to go to their villages and work for the early detection of illnesses. By doing so, we endeavored to satisfy their needs. Physicians, nurses and paramedics went out to doctorless villages on holidays to deliver medical care on a voluntary basis. They made it a practice to put on a health-related drama or give a puppet show after the delivery of medical care. All the dramas were of Dr. Wakatsuki's own writing, and the actors and actresses were all from the hospital staff. Virtually no commercial entertainment was accessible in rural communities. Villagers really enjoyed the dramas presented by the medical team, thanks to which they could come to know bit by bit about health, hygiene and disease. Then there came increasing calls from the outlying villages for the dispatch of a medical team. In response to these requests, the hospital formed a team which would go the round of hamlets without physicians during their off-duty hours on a regular basis. Here the hospital's motto, "Together with farmers," was at last translated into action. The medical team found an astonishingly large number of villagers with serious symptoms. Their illnesses gradually worsened while they bore the pain with stoical resignation and toiled at their farm work. They were so appallingly poor that they had to do so in order to live. Sent out from the hospital, physicians, nurses and paramedics went as far as going into the fields and checking the health of those at work there. It was a common practice for all family members to do farm work together unless they were seriously sick in bed. While delivering medical care in hamlets without physicians, the hospital staff came across many patients whose symptoms medically proved too late to cure. Dr. Wakatsuki categorized into two types the diseases traditionally peculiar to farming populations: the diseases which the patients adamantly tried to put up with, and those of which the patients remained unconscious. His classification would eventually prove to be a milestone in the milieu of rural medicine in Japan. Until the early 1960s, Japanese agriculture had relied solely on the work of people and cattle. Rice production and rice replanting in particular required quite heavy labor. Many hours of work in the paddy fields would result in people falling victim to hiesho, a syndrome deriving from the cold, and lumbago. A conspicuous effect of hard labor was that, having done farm work in a stooping position as often as not for many years, old farm workers eventually developed bent backs. Frequently carrying heavy things on a pole was responsible in most cases for the deformed shoulders and knees that were seen. Japanese farm workers primarily used barnyard manure and human waste as fertilizer, with the result that every villager carried intestinal worms. The meals consisted mostly of carbohydrates and salty food. The protein intake was insignificantly small. Many people in the rural areas suffered and died from hypertension. The rural dwellings in those years were appallingly dilapidated and unsanitary. Cattle were treasured so much that they were housed under the same roof as humans. It was by no means uncommon to see clouds of flies incessantly swarming. A check is made here on the incidence of tender vaginitis, an inflammation of a tendon and its sheath. The black thread tied around the wrist is what farm workers use to try to charm away the disease, believing that by so doing it would be healed sooner or later. This absurd superstition died hard. The doctor examines an extraordinarily warped spine and waist. The shoulder muscle is seen to be deformed from using a carrying pole. This man has a huge bump on the right shoulder. Dr. Wakatsuki began to perform a series of exhaustive surveys on the symptoms traditionally peculiar to Japanese farm workers and their environment. The surveys led him to hold an unshakable belief that prevention is better than cure.